Hello everyone, good evening. Today we will discuss about craniosynostosis. It is a frequently asked 7-mark question in your university examination. So let's start with its incidence. It occurs in 1 in 2000 to 2500 live birth. Okay. Going on with its definition, this craniosynostosis is nothing but premature fusion of one or more cranial sutures. It is a premature fusion of one or more cranial sutures, thus resulting in abnormal skull shape. Okay, so it is nothing but premature fusion of one or more cranial sutures, thus resulting in an abnormal skull shape. Okay, next, this occurs, most case occurs sporadically. So most cases occurs sporadically. Some cases can occur due to hereditary causes. Among hereditary causes, autosomal dominant is more common than autosomal recessive forms. Okay, so the genetic cause is mainly due to or secondary to mutations in FGFR2 gene, that is fibroblast growth factor receptor gene. So genetic causes is mostly due to secondary to mutations in FGFR gene. Next, going on with its pathophysiology, it occurs mainly because the normal bone growth is being impaired. So normal bone growth is impaired in a plane perpendicular. This is perpendicular, in a plane perpendicular to the fused sutures. So this craniosynostosis is mainly because of the normal bone growth which is being impaired in a plane that is perpendicular to the fused sutures. But the parallel plane, in a parallel plane, the bone growth continues to remain normal. Okay, in a parallel plane, bone growth continues to remain normal. So this is the reason for the craniosynostosis. Okay, next we will see the types of craniosynostosis. First, the most common type is scaphocephaly. This scaphocephaly is nothing but premature fusion of, it occurs due to premature fusion of the sagittal sutures. So the premature fusion of sagittal sutures is called as scaphocephaly. The distribution is around 40 to 55%. Okay, next is brachycephaly. This is brachycephaly, that is bilateral fusion of both the coronal sutures. So premature fusion of both coronal suture is called as brachycephaly. It occurs in the incidence of about 20 to 25%. Okay, next is trigonocephaly. Trigonocephaly is nothing but premature fusion of metopic sutures, is called as trigonocephaly. It occurs in around 5 to 15% of the children. Next is plagiocephaly. This plagiocephaly is nothing but premature fusion of either one coronal suture or one lambdoid suture. Okay, is called as plagiocephaly. It occurs in 0 to 5% of cases. Next is oxycephaly. In oxycephaly, It is premature fusion of all the sutures. When there is a premature fusion of all the sutures, it is all the sutures, it is called as oxycephaly. It occurs in around 5 to 15% of the children. Okay, so these are the types of craniosynostosis. First one is scaphocephaly. This one, scaphocephaly. Next is brachycephaly. Third one is trigonocephaly. Fourth is plagiocephaly, and fifth one is oxycephaly. Okay, next, what are the factors associated with the non-syndromic premature fusion of these cranial sutures? So this craniosynostosis can be a component of some syndromes, but it can also occur in a children without any syndromes. That is non-syndromic premature fusion. So the causes or the factors associated with this are environmental factors. Second, multiple gestations. That is twins, triplets, quadruples. Fourth one is abnormal infant position. Fourth one, it can occur due to uterine abnormalities. Fifth, when the mother takes a teratogenic drugs. So when the mother takes the drugs such as nitrofurantoin or warfarin during antenatal period, and endocrine abnormalities. These can result in premature fusion of the cranial sutures. One is environmental factors, next is multiple gestation, abnormal infant position, uterine abnormalities, and teratogenic drug intake such as nitrofurantoin and warfarin, and the endocrine abnormalities. Okay, next, syndromes that are associated. I will tell you few syndromes that are associated with this craniosynostosis. First one is Crouzon syndrome. We have seen the differentiation of Crouzon syndrome and Apert syndrome already in the previous video. So Crouzon syndrome, Apert syndrome. Third, FGFR2 related isolated coronal synostosis. Fourth one, it can occur in Jackson-Weiss syndrome. Fifth, it can occur in Pfeiffer syndrome. These are the few examples of the syndromes that are associated with the craniosynostosis. That is Crouzon syndrome, Apert, Jackson-Weiss syndrome, and Pfeiffer syndrome. Okay, next, what are the functional consequences when the child have a craniosynostosis? So when there is a premature fusion of these sutures, the brain growth or the intracranial structures growth is being restricted. That can result in elevated intracranial pressure that can be more than 15 to 17 millimeter of mercury. This can occur in around 50% of the patients with a multiple cranial sutures fusion, or in 14% of the patients with a single suture fusion. Next issues can be, the child can develop hydrocephalus. It can be either communicating or a non-communicating hydrocephalus. Next, there can be abnormalities in the speech. The child can have abnormalities in speech and hearing. Fourth, the child can present with blindness. This is because of optic nerve atrophy. This can occur due to optic nerve atrophy or corneal exposure. Fifth, the child can have developmental delay. Sixth, there will be abnormalities of the airway. Seventh, there can be malocclusion of the teeth. So these are some of the functional consequences due to the premature fusion of the cranial sutures. Okay. Next, the main differential diagnosis for this is deformational plagiocephaly. So in deformational difference between this DP and the synostosis is head shape at birth. In deformational plagiocephaly will be normal, while in synostosis it will be abnormal at the time of birth itself. Patient preference to sleep will be present in this deformational plagiocephaly, well, it is not in synostosis. Bald spot is present in DP while it is not present in synostosis. Signs and symptoms of raised ICP is present in synostosis and not in deformational plagiocephaly. Next, common distinguishing feature is here the child will have its ipsilateral ear will be pushed anteriorly, while here the ipsilateral ear will be pushed posteriorly. Okay, there will be an abnormal skull shape at the time of the birth itself. Here the abnormal skull shape will not be present at the time of the birth. It is mainly because of the positional variation. Okay, so the main mode of management for this synostosis is surgery, reconstructive surgery. In some cases they use helmets also. Here the management is changing the position, that is repositioning. Next, surgery. In some cases they use helmets. Okay, so this is the difference between deformational plagiocephaly and synostosis. It's a short topic, but it can be asked in your 7-mark questions. So you have to quote these points to write it in your 7-mark questions. Okay, thank you. Please like, share and subscribe our YouTube channel. Let's all learn our pediatric together. For next